So genital psoriasis is very common. Up to 2/3 of patients at some time point during their disease course will suffer from genital involvement. And it's been shown over and over that the presence of genital psoriasis has a very considerable impact on a patient's quality of life, their relationships, their sexual health, compared to patients who don't have current genital psoriasis. The symptoms can often be much more severe in the genital area than other places. And the presence of genital psoriasis can be very stigmatizing. But unfortunately, there are very few effective treatments for genital psoriasis. We're very limited when it comes to topical treatments. We can only use mild to moderate potency steroids. We can't use UV therapies. And it has been recommended that systemic and biologic treatments be used in patients who are resistant to topical treatments. But unfortunately, no randomized controlled studies have been done up to this point to evaluate the efficacy of systemic or biologic agents to treat genital psoriasis. So patients with moderate to severe genital psoriasis were recruited to this study. They had to have a PGA of genitalia of 3 or more and were randomized 1-to-1 to Ixekizumab versus to placebo. What was interesting or a little bit unique about this study was that patients needed to have just 1% or more body surface area involvement of their psoriasis for inclusion. So about 40% of the total study population had between 1 and 9% BSA involvement, and the other 60% had 10% or more body surface area involvement. The primary endpoint was achieving a PGA of 0 or 1, so clear or minimal, of genitalia at week 12. And then there were 3 major secondary endpoints: the overall PGA, then the sexual frequency questionnaire item 2, and the itch numeric rating scale. So looking at the primary endpoint, 73% of Ixekizumab treated patients achieved a PGA of genitalia of 0 or 1, so clear or minimal, versus 8% of the placebo-treated patients at week 12. But this was statistically significant as early as week 1. And what was interesting was when you compared the patients who had less than 10% to those who were greater than 10%, very similar percentages were seen. Looking at the major secondary endpoints, for overall PGA, we saw results that were very similar to the pivotal phase 3 studies. So 73% of patients on Ixekizumab versus 3% of patients on placebo achieving a PGA of 0 or 1. And then most importantly for me in some ways, looking at the impact on the sexual frequency questionnaire item 2. So for the patients who thought that their genital psoriasis impacted on their sexual activity, by week 12, 78% of patients treated with Ixekizumab felt that it now rarely or never impacted on their sexual activity, compared to 21% of placebo-treated patients. I think this is a pivotal study in so many ways. It was the first study to evaluate a systemic or biologic agent for the treatment of genital psoriasis, and I really do hope that many other studies will follow. It showed that Ixekizumab was superior to placebo at every endpoint, primary endpoint and major secondary endpoint, and as early as week 1 for most endpoints. But I think most importantly, I hope that this study will raise awareness about the impact and nature of genital psoriasis, and that dermatologists will ask their patients at every visit about the involvement of genitalia and take action if their patients are suffering from genital psoriasis.